Good afternoon, everybody. Today is the day that the vet is coming to check out Earl to see what's going on with him. Seems completely normal right now, and he really has been for several days. But as you saw on Monday's video, there was definitely an issue with his mouth. So we're going to get into that as soon as the vet comes. This morning I took out Belle and Duke and did a little logging, and Earl's been outside, but we brought him in so he'd be here when the vet came. So I'm going to brush him down and talk about a few things. So with Earl, about 3-4 months ago, we had the same type of issues with him that we're having right now, except they kind of stayed with him. And we did a bunch of tests, the vet did, and we kind of came to the conclusion, or sort of thought, that it was Lyme's disease. So we put him on the full amount of antibiotics that goes along with Lyme's disease, and he got better pretty quick. So that's what we've done, and if you saw Monday's video, you'll see what he's doing now. And even a few days before Monday's video, we had some issues with him drooling out in the pasture quite a bit, and a little bit of grinding his teeth. So we hope to get to the bottom of this, maybe even today. Another thing I wanted to share with you guys is we're kind of doing some changing in our videos. We're going to try something a little bit different. We're going to sort of make more, a little bit shorter videos, but maybe a little bit more often. We're still planning on having our videos every Monday and Friday, but we hope to have a few scattered in throughout the week along with them. And one more reason to subscribe and hit the bell so that you know when a video comes out, because they could be very sporadic throughout the week. We're still gonna have those regular Monday through Friday and Friday videos, of course. We hope to, but yeah, it's just going to be a lot of shorter videos on a specific subject. I think sometimes when somebody has a desire to learn something about something in general, they like to look it up, and if it's on a video of mine, I think it's going to be easier for people to find something specific: how to brush a horse, how to harness a horse, how to drive a horse, all these different things that people would like to learn about, but it's so difficult to find that specific thing that they want to learn about. So I'm going to try to be a little bit more specific in some of my videos so that people can find things that they're really looking for, and to be able to learn a little bit quicker than digging into some of my videos. I have a lot of my stuff over the years in each video has had a lot of different information, but it's just hard to find some of that information that's maybe in the back of the video. And if I just have shorter videos with that on it, I think it might work better for a lot of people. I'm still going to have regular videos, and even got a lot of field trips planned that we're going to go to different places and talk to other people. And so that's going to be on our videos also. So I would love to hear your comments on what you think of this idea. And I'm also going to try to do a lot of talk over on my videos. I think sometimes it's easier if I just film everything, and then at night when I'm video editing it, as I'm looking at it and seeing the same thing that you're seeing, I can explain what I'm doing, and it might make it a little bit clearer to you. So many things in my operation I just do without even thinking about it, and I think it's that everybody knows what I'm doing, and I have to realize that a lot of you guys don't know what I'm doing. Unless I explain it out, you're not going to know. So that's what I'm going to try to do. So let me know in the comments if you think this is a good idea or any other ideas you might have. So hopefully the vet will be here very soon. I'm sure she will. And we'll get on to finding out maybe what's been going on with Earl. Well, I guess I'm going to put out Belle and Duke, go out with Lady, since they got a few hours to go play in the snow, get over. This afternoon, they might as well get out of here. Back up, back up, back up, back up, back up. Get out of here. Here we got Olivia here. Olivia has helped me on the farm a little bit, and she is working full time for Lila, our vet that does mostly horses. Hi, Lila.
Hello. Had two things going on. It could be that we had the wrong diagnosis, right?
Right.
We don't really know, but I'm encouraged that he's not, dysphagic right now. He's not like putting food in his mouth, trying to swallow, and then just like letting it come back out, which is what was really concerning last time.
Right.
But we need to look in his mouth.
But it's still to me anyways, very odd that it's two different things.
Yeah. Oh, it could be that Lyme disease wasn't causing the dysphagia in the first place. I'm sort of hoping, though, that this is because other things that can cause dysphagia
Are worse even.
well, or just like harder to diagnose. Like a tooth problem is not going to cause them to have the inability to swallow. Like it will make it difficult potentially to chew, but like for him to be like take a sip of water and then have it just pour out of his mouth when he's trying to swallow, a tooth problem is not going to cause that, right? So then we're going down this rabbit hole of really weird things that are harder to diagnose versus like a tooth problem is something I can hopefully fix and make him feel better pretty easily. So I'm hopeful that we float him or maybe find something totally horrible that I can fix.
So another thing with Earl, when this happened, when was this? That happened
I meant to check
2-3 months ago.
I feel like it was October.
Yeah.
I think it was October.
So I remember clearly taking him out and spreading a whole bunch of manure. And Brenda was the first one that noticed the drooling.
Yeah.
But then the day before this happened again, I was working him also. So I wonder if there's something there that's affecting his tooth and make it kind of long lasting.
Tooth or jaw, like he could have, look at his doing that yawning thing right now. Tooth or jaw pain, like if he's got some issues in his jaw that is hurting him, which are really hard to diagnose without really good imaging. Yeah, but that would be like, okay, he just had, equipment in his mouth and he was working hard and that sort of thing. But
I thought, if I didn't have a vet available and I had nothing else to do, I'd try a rubber bit and see if that made a difference. Because if it's expecting something in his mouth, a rubber bit would possibly help that.
Yep.
It doesn't fix the problem. But a lot of times problems fix themselves if I could get.
If you figure out what the trigger is, sort of thing. Yeah. And there's not much. I don't know. I think we need to start with ruling out the basics and then talk about the weird stuff.
Okay.
Yeah.
I'll bring him out here.
Actually, right behind the truck, if you could do that tight circle right in place. And back the other way. Totally normal. All right. And then back to the barn. He's totally, and when you were working him, you didn't think he had any issues walking or anything like that?
I'm in the barn or in stocks?
If the barn is warmer, I'm happy to work on him in there.
Let's do it. If I'd known that, I'd have filled it with horses for you. Go ahead and shut that door.
Yeah, it's definitely warmer in here.
Have you done any more with your horse, Olivia?
Not much, no. Not much.
Olivia has a riding horse she wants to start driving.
I'm going to stick with what you had said, and I'm going to have you help me with that one.
Okay, turn over a little bit. My goodness, you must work for a good boss. Look at that nice coat you got.
I do. I'm all official.
Wow, nice.
It was my Christmas gift.
Nice.
I know, I told her I was super excited. It was the first thing with the LVT after my name.
Yeah.
I was super excited.
And she's the first licensed vet tech that's ever worked for this practice, which is kind of cool.
Oh, really?
Oh, Earl, he looks so mad.
Got to clip my manes here, but when it's cold, it's not fun to do.
No. I'm going to hammer a roach my pony, too.
Oh, yeah?
I can't wait to bring him over. That's going to be some video content for you if he puts on a whole ordeal.
Who, Boulder?
Yeah.
I'd rather have a dull video and have him not put on a whole ordeal.
Yeah. Yeah.
He's doing good on the saddle and dragging stuff.
Oh yeah, he's fine. He's fine. But it's only with me or an experienced rider. Like if you're a little bit
Right,
scared, or
right.
if he thinks he can push you around, he'll get away with it. He's gonna.
So what are you doing with that?
I'm just checking his cranial nerves. So doing a basic like neurologic exam, make sure his pupils dilate. When I shine a light in there, I'm going to make sure he can feel it when I poke his face, and then make sure that he can pull his tongue back in. Super basic like neuro exam, just to make sure we're not seeing any of those neurologic signs.
So now when he was making all those movements with his mouth earlier in the week, he pulled his tongue out and put it.
Yeah. Whereas before, you had told me once he didn't, and then we saw that dysphagia, which I guess that's sort of like, are there a couple things going on? Yeah, his tongue feels really strong. And then I just check their face, look at them straight on, make sure they have symmetry on both sides. There's not part of their face that's kind of drooping. And then just basically that they can feel me touching everywhere. So like, neurologically, he's completely appropriate today, so that's good. And like the main reason we kind of diagnosed that chronic Lyme and went down that route was because of the presence of the dysphagia, or a true like neurologic symptom, which hopefully he's not really having right now.
Right.
All right, I'm gonna get him sedated, and then we'll get his teeth floated and see what's going on in his mouth.
So I got a question on floating teeth. So I know you are going with the machine. What are your thoughts are just the hand floats?
My thoughts are they do the same thing the machine does. It is technically more difficult, and there are a few things that a regular hand float cannot do, even in very skilled hands. So specifically in the mouth, and there's a few places in the mouth where they tend to get hooks and points, and one of those places is in the back on the bottom arcade. So way in the back of the mouth, right up against the gums. And in order for a hand float to work, you need to go like this, right?
Yes.
And if you're just at a blunt end,
Yes.
you cannot get that point down. So what I've seen a lot of times going behind hand floaters, so the horse still is having issues and I get called out, they may be able to float these top enamel points just fine, as long as the horse doesn't have any issues, but a lot of times that's completely ignored. Now, I have one guy who is a lay floater, so a non-vet that floats, and he uses hand floats, and he's my client actually, and he's pretty trained and did a lot of teeth for a long time. And he showed me the tool that they use. There is a tool for getting that point off.
Oh, yeah?
It's like a guillotine. He's like, yeah, I don't like using this. I'm like, yeah, I wouldn't want to either.
Wow.
So I think that when I first started, I hand floated everything. And then once I figured out, I felt like I knew what I was doing. I bought that, and I always say I can do like twice as good a job in half the time.
Yeah, half the physical labor of it all.
Yep, I can do like more floats, less money for the client because I get paid by the hour, so it doesn't take me as long, and I do a better job. Now, you can certainly take off too much tooth quicker than with a hand float, but like if you know what you're doing, you're not going to do that. So, and the nice thing about it too, I can just show you. So like with the hand float, you're having to move it back and forth to get that power, which can damage the soft tissues around, like the gums and the cheeks.
Yes.
With this, all I'm doing, it protects, I'm just putting that right onto that tooth that I'm grinding down, and so I'm protecting all of that soft tissue.
Okay,
so there's going to be, it's less painful, it can be less painful, less damage to that soft
Now,
tissue.
you spin that so you can do the bottom side?
Yeah, this is the top.
Yeah,
so I'm gonna go in, and then, if you gotta do the bottoms, oh my gosh, it's so cold, it's like seizing up. Then we're gonna do the bottoms like that. So this thing, I know that there's people out there like, oh, it's a very dangerous machine, but like, yes, in the wrong hands, any machine is dangerous, and this could probably take off more tooth quicker.
So a guy like me, for example, and I really have no desire to do this, I'd rather hire you to do this, but is it fairly easy to touch it up a little bit and practice just by a little bit at a time?
So it is a hard skill to learn. It is a hard skill to learn. I have vet students all the time who come with me and they try it, and it's just an awkward thing to learn. And I probably took 2 years to feel like good about what I was doing. I wasn't harming anything, but I was like, oh, this is awkward, and I'm not quite sure if I'm at the right angle. But you know, it's actually pretty controversial.
Yeah, I'm sure it is.
And there's some vets that might not be comfortable doing teeth, you know, and then hopefully they're not doing teeth. You know, it's a skill that you have to learn, just like any other skill that we learn. But yeah, tools like sedative, antibiotics, x-ray are things that I have access to that are very helpful for doing a good job in the mouth, you know.
I know over the years I've had people float my horse's teeth always by hand, you know.
Yeah.
And I just grimace, I guess is the right word, as much as the horse does. So glad when it's done. I hate it so much.
I've had quite a few clients where for many years they had lay floater, and when I say lay floater, it just means like a non-veterinarian floater that's usually doing an unsedated float with a hand float, and they're always like, oh, you know, they're very worried about it. Are you going to be gentle? And I'm like, yes, I'm going to be gentle. And then afterwards, they're always like, oh, that was just so much better. And probably sedation has a lot to do with it. I don't think it's the hand floats that are like, you know, hard on the horse. If you know what you're doing, you can do a good job. But for them to be awake, it's definitely a stressful thing. And you really should have the mouth open to see what you're doing.
Oh, yeah, yeah. I remember years ago, just the tongue was out. I held the tongue, and they went in there and couldn't see a thing and just floated away.
Again, like on a normal horse, and I've had some people who call me, and you know, they're like, yep, I floated there, and I'm just keep hitting something. And I'm like, and they call me, which is, you know what, great. I get out there and I open their mouth, and yeah, they have a giant hook coming out, and like, I'm glad they didn't try to keep floating that with a hand float, because they were going to break the tooth, basically. So, you know, like anything, you have to know what you're doing, and like anything, any tool in any wrong hands can be not good.
Yes.
But, all right, let's get you drunk.
He seems half sedated.
I know.
I know. Oh my goodness, here's a big fly.
So that is what?
This is a sedation, so butorphanol and dermocidine, an opioid and an alpha-2. And it's also pain, so I think it makes them, and kind of relaxes their muscles too. Makes it easier to open their mouth and all that good stuff.
Haha, yes. Short people problems.
He seems pretty open to open his mouth today. Just last time he was a little bit hesitant too. I'm just gonna palpate in his jaw too and see. It's like a lot of muscle to palpate through. You got a thick face, buddy. See if he has pain anywhere.
Would he flinch if it was in pain with the meds you just gave him?
Potentially, maybe not.
I mean, if it was
pretty
a
out.
lot of pain, I'm sure. But.
Yeah, I only just want to see like if anything feels like asymmetrical, or, and I'm also feeling along for any draining holes. If he had a tooth root abscess.
Yeah.
Which I don't see anything. Looking for the weird stuff now.
So this is called, I know what it's called, but
no, that's all right. This is a speculum, which just basically holds his mouth open so I can stick things in the back of it without getting bit. Let's see.
Too tight?
I think that should be good. One more, if you can get it.
So for you guys that are watching, when
Mouth is opening a lot.
Earl was, Olivia, how old was Earl when you were working here?
He was just a yearling, wasn't he?
Just a yearling, I think, yes.
And how old is he now?
He is 5, going to be 6 in June, or May, June, something like that.
It was a lot of fun driving through Duke the other day and being like,
Yeah.
I sat on this thing when he was a baby.
Yes, yes, and brushed him a lot.
Yes.
And led him around quite a lot, if I remember right, too.
He was always my favorite to sit on the.
All right, pick that heavy thing up.
I liked Earl.
Oh, we didn't rinse his mouth
Oh yeah, let's fix those.
Oh, and now you're too high.
Okay, half step.
Well, that was all packed in between his sharp points and his teeth, or in his cheek.
I'm gonna move this up forward a little bit. Sorry.
Yep.
They're 5. That's crazy.
Almost 6.
That's crazy.
Tell me if you need a break.
I'm good.
Do you remember last time he had those weird ulcers in the back of his
Yes.
mouth?
Yes.
They're pretty much healed.
Oh, good.
Yep, pretty much healed. I see them, but they're not really there, which is promising that maybe
Yeah.
something was going on that is getting better.
But we gave enough antibiotic with the
Right,
limes.
right. I know, and like doxycycline is an antibiotic and an anti-inflammatory, so who knows what we were treating.
Right.
But I do want you to feel, I'm just inspecting, he's got all of his premolars and all of his molars, and I don't believe he has any caps on the top.
Oh.
No.
Oh. Oh.
Yeah, let me know if you need a break. And then I'm checking the bottom. 1, 2, 3. No caps on those ones. So the caps are the baby teeth that by 5 really should be gone.
Right.
And if one was, say, stuck on there, probably would be causing problems. And I don't see anything there.
Is he high enough for you?
Yes. He's very pointy, which I'm gonna get my float, but if you want to feel, you can. So I want you to stick, I don't know if you can see where my hand is. I want you to stick your
You mean
hand
the top or the bottom?
on the top.
Okay.
Stick them right here between.
Towards the gums, from the sides.
Yep, towards the gums.
That's what I was looking at and thinking of. Oh, yes. Oh, my goodness, yes.
So I'm wondering,
I hate to have
Jam,
that running down my...
if he had like, I know you feed corn cobs or like oats, if he had a wad of something stuck in the
Behind that.
ulcers that are on his cheeks, which would explain why it was like there and then suddenly better, and he was like, ow, ow, ow. I'm hopeful that's what it is.
Yeah.
Oh boy.
He's being a really good boy.
And when we float the teeth, I think some people get confused. We're not grinding down the surface of the tooth.
Right.
We're just grinding down those sharp points. Yes. Yeah, if you want to see, like, this is...
Well, I felt. I'm
Yeah.
curious, when you're done with that top,
Yep,
I'm
Yeah.
These horses aren't supposed to have smooth teeth on the surface because they need to be able to grind their hay.
Yep.
Horses are, but these points are what will end up causing them pain. All right, you can feel that. Pretty much done on that side.
There's a huge difference, yes.
Yeah.
Which,
So you can. I haven't done the other side if you
Right,
want
I know, I'm
to
just-
compare.
the bottom doesn't feel too bad.
And the bottoms, they get points on the inside of the tooth.
Oh, really?
Towards
Okay.
the tongue.
Okay. these
And they
are sharp
tend
on
to
that
not
side.
get as bad.
They're definitely sharp on that other side still.
Nothing crazy, but I'm hoping that it could be,
Well, to me, it
Explaining-
seems like quite a lot.
I mean, it is, yeah, and I'm hoping that maybe the reason it was so short term was that, he got something stuck. And who knows, maybe he had something stuck for a long time before. He got an ulcer in the back of his throat, which
Right.
was making it hard to swallow.
Right. working horses since before both you girls were born. But, you know, I don't deal with teeth. I never dubbed around with this. And this is very good because I know
Yeah.
that's what we're
Yep.
what we're feeling. That's great.
Yep. Yeah, I always feel like even the most experienced horse people, I have them feel, because you never really get that chance.
No. And that.
You'll bite your finger right off if you stick your hand in there. The speculum.
Yeah, but you can usually hold the tongue and do it.
Yeah.
Because I've done it plenty of times, but I've never really known what I was looking
All right,
for.
now we're gonna do the bottoms.
And I didn't know the bottom was tend to be sharp on the inside.
Yep.
Oh my gosh, such a fat little tongue. Short little tongue.
So see how like they're a little more
Yeah,
pointy
yeah,
right there?
Definitely.
And that can cause some ulceration in the tongue. Usually it's not as bad though as the tops. You can actually see right there, Jim. See that right there on his tongue? Those are all. Here, I'm gonna show you.
Where the tongue's been scraped.
Yeah, right.
yeah.
Those are ulcers from his sharp
Oh,
points.
yes, I can
See that?
Oh my! I don't know if the camera caught it. That's all right.
Yeah. And then he has that hook I was telling you about in the back that I took down, which will help him. His teeth grind normally. Other side. Olivia's getting her full body workout in today. So I'm gonna give him a really good rinse and then go in with my mirror and examine everything. One good thing that I will say is that he is not sensitive at all when I float his teeth.
Right.
Sometimes if they have like a festering problem underneath, I get to, or like a cap that's still attached, I get to it and they're like, ow. Nothing like that. So everything looks normal and feels normal. From the inside at least. It, again, doesn't rule out deep problems, but
It's definitely a good place to
yes.
get this done and then go from there.
Exactly, yeah. Yeah, I mean, this is a good start, and I think, let's see how he does. There's a very good chance that he had painful ulcers, that he got something, you know, feed packed in there or something, and then it just really hurt for a day.
Can we talk about corn for a little bit?
Okay?
I'm very confident and very happy, and I don't want to stop feeding ear corn.
You mean like corn on the cob type of
on the
corn?
cob.
Okay.
I remember years ago, a veterinary that we used, he had racing horses, and he swore by it. He says it's so good for the teeth to have this
Okay.
ear
Yeah,
corn.
yeah.
And other people have said that too, but he
Yeah.
was a vet and,
Yeah.
a very good vet. I learned a lot from him.
Sure.
But it's just funny because I have had a lot of people say that you shouldn't be feeding
Yeah.
that. And I don't agree, and unless I can find some really good reasons.
Well, I guess I don't have anyone else I know that feeds it that I like know about on the cob. The concern I have with it is big chunks, if they're not fully chewed, getting lodged like a choke situation, or in like a case like him, if he's not fully chewing or it hurts to chew, is he getting pieces stuck up in pockets and things like that? How much are you feeding? Like just a few cobs a day?
1 to 2 ears of feeding.
Okay, so it's not like
Oh, it's not a huge
yeah,
amount.
and I don't like corn in general as a feed source because it can really upset their GI flora, but I don't think that is enough to do it. It's not that much actual
Every
grain.
corn in commercial, every commercial grain has corn in it.
Right. It's all in moderation, right?
Yes.
So that's not a lot. If you're feeding like a bucket, I'd be like,
No. And I don't feed corn generally in the summertime, just the winter.
okay.
'Cause
So
the corn
the
helps
way that
heat.
I see that it helps, if we think about a horse in the wild, they're eating grass, hay, sticks, like true rough, coarse things, which do probably, that occlusal surface, they're probably grinding down that tooth more evenly all over the mouth. Whereas a horse on a high concentrate diet, they're not probably grinding as much, so they may have uneven wear around their mouth. So I can see sort of in feeding something that's rough on the occlusal surface of the tooth, it makes them chew and grind. So I can see that side of it. But I also could see in some horses, like I would worry about choke and things like that. And for him, I'm wondering, and maybe it was hay or whatever it was, if he just had something balled up in a painful spot,
At one point you told me that they'll get choked sometimes from oats because they go in and just go right so fast up. So
Yeah.
just put a rock in there. Well, having the ear core in there slows them
Yeah,
down from
yeah.
eating the
Okay.
oats.
Yeah,
So
fair
that's
I
another
think,
thing.
and I think every horse is different. I mean, I have some people say like, oh yeah, my horse loves beet pulp, and like, they don't soak it or anything, and they do fine. And then another horse who has fine teeth, they'll just eat that beet pulp so fast they just choke. So I think it depends, and he may, you know, from what we're seeing, he's a young horse. I'm not seeing anything super obvious dental issues other than very sharp points, which we just fixed, right? He may have some jaw, you know, a sensitivity, like a, you know, pain in his jaw or something at certain times, and he might be more sensitive to certain things. I have no idea if it's the corn or the hay or whatever it is, but I don't think you need to stop feeding it. I wouldn't feed like buckets of it.
When he got what we thought might have been Lyme's disease, he was not getting corn at that time.
Yeah, yeah.
So that
Yeah.
really didn't do
So
it the
that
first
wasn't
time
it,
around.
yeah. And again, like, I'm not saying he had Lyme disease according to his blood work, or he could still. The dysphagia is really what I'm glad he's not doing, the neurologic
Yes.
symptoms.
Yes.
So I'm not saying it was Lyme disease, but maybe it was multiple problems. And when
Right.
he started having trouble swallowing, I mean, before, when I looked at his mouth back in October, he had these ulcers back there that are, I can see where they scarred down, but they're not open anymore.
Right.
So maybe he starts having a process when he's under stress or something with his, who knows. I wish they could tell us, but they can't. I'm going to look in one more time before he wakes up. I don't think he's waking up anytime soon, but. All right, that's better. All right.
When you were in vet school, did you have this available at the time?
Like to learn?
This.
Oh, yes, when you can let go of this. Yeah, in vet school we had like a herd of teaching horses, and they taught us both, like we practiced
ways.
with both ways. Yep.
I mean, because that really hasn't been around that long, has it? Maybe it has, and I just...
Somewhat long. Okay, so he does not have wolf teeth, just FYI.
He does not?
No.
I thought they all did.
Nope. Sometimes, no. It's kind of weird though that he doesn't, but he doesn't as far as I can tell, unless they're blind. Ooh, do you not like that? Does that hurt? Do you have blind wolf teeth? Is that your problem? Huh. Okay, so I'll show you where the wolf teeth usually live. They're usually right here in front of that top tooth. Okay?
Okay, yeah.
And I do not see any.
Okay.
These are not wolf teeth. Okay?
Okay.
Those are just his boy teeth.
Okay.
And those are usually non-problematic. But the wolf teeth can be problems because the bit sort of sits right here.
Yes, yes.
Now, when I push into those spots right there, where the wolf teeth should be, he is saying, ow. There is something called blind wolf teeth where they have wolf teeth up inside that are not erupting. And we could probably pretty easily rule that out with an x-ray to see if there's teeth there, right? Because if wolf teeth usually actually don't cause many problems unless they're abnormal. So if they're just normal wolf teeth sitting there, it usually doesn't do anything wrong. But I've had horses with like one wolf tooth and not the other, and so the bit's sitting like this, and that can cause big issues. But if he has two blind wolf teeth, if you imagine a tooth trying to pop through, and then you're pushing something up against it,
Yes.
that could explain something.
But you think it don't explain it when you're using it.
Well, you're saying it exact. I don't really think it explains this whole thing.
No.
But he's awfully sensitive to that.
That's interesting.
Well, didn't you say it does seem like it's after you work them that he's...
We did it, it happened twice, and I've worked them a million times.
Yeah,
Yeah.
Yeah, that's true, that's true.
So let's see how he does.
Yeah.
I don't want to X-ray his. If we go down the next road of we can be done. He's all good. We're gonna get his halter back on. Just to kind of talk about next steps. Say like this does not help, and he continues to do this. I do think some sort of imaging. Feeling that I might be able to just quickly rule that out, and that is surgical removal. But you have to know they're there to go fishing around for them. But if he say that's not the problem and we're like, what's going on? I do think probably the next step is imaging of his skull and deep roots of the teeth, which frankly is probably out of my wheelhouse with this large of a head, because my x-ray machine probably can penetrate, but the technique for those sort of images is really difficult. And interpreting them is really difficult, and it's not a strong suit of mine on this big of a horse. Well, let's see how he does, because I think there's a good chance. And I can definitely x-ray to rule out blind, definitely. I think I could rule out,
know.
like, there's blind wolf teeth right there.
Yep, yep.
That would be easy
So
enough.
you would say it's actually fairly rare. You hear a lot of people talking about the wolf teeth, and
Yeah.
I've had a lot of horses, and I've never had an issue with
Yeah,
it.
because it usually doesn't cause
So
an issue.
it's really not very
It's
often.
very much like,
It's like wisdom teeth to a degree.
maybe, I don't know much about that, but like most horses would be fine with them. However, I used to be like, oh yeah, they're usually fine, but people want me to take them out, take them out. But I have seen some interesting ones lately where I definitely think the wolf tooth was bothering them.
Right.
Like one, I had a giant wolf tooth on this side, not on this side, and when he showed me the bit, it was a rubber, like had rubber, and it was just worn out on the side with the wolf tooth and
Oh,
not
really?
on this side. And then the
Interesting.
horse had a big ulcer right below that wolf tooth. So
Interesting.
clearly that bit was like, really
yeah.
jammed. And then I had another one where the wolf tooth was sort of like wiggly. So then I can imagine too,
Right.
okay, that's going to hurt if it's
Yeah.
wiggling around.
Yeah.
So, and then blind wolf teeth can certainly be painful, like
Yeah.
if he has them and they're not erupted. So that is a possibility. I don't know if I could explain all of this from that, but
Right.
definitely seems like he is sensitive. So maybe one of a different bit could be helpful if, yeah.
So my guess is I'd probably just keep the regular bit in he has right now, and then maybe
Yeah.
if it
See
seems to-
how he does.
Yeah.
Maybe, and then like, oh, everything's better. He doesn't do this anymore. Okay, he didn't like his sharp points.
I mean, I've had a lot of horses I like using rubber bits on,
Yeah.
especially in the wintertime. It's cold.
Right.
I mean, you just throw them in. You don't have to wear
Yep.
cold bits. and
Yep. Yeah, I mean, and
They've done good with rubber bits.
he was very sensitive when I pushed on that spot.
So
So something to think
I would definitely
about.
consider that even still for him.
Yeah, yeah. Okay, well, keep me posted.
All right.
The only other thing I can offer is a retest on the Lyme. I think, I don't think
it's
this, like, if I just came out today for the first time, Lyme disease
Never would've been.
would not be on my radar at all. So I kind of don't think that's what is causing this issue.
And maybe it was before, but
Yeah, or multiple things, who knows? Who knows? He'll never be able to tell us.
no. Brenda thinks she can talk with horses, so maybe she'll tell her.
There have been a few cases where I've recommended, you know what, at this point, I think you need to call a horse communicator because I don't know what's wrong with the horse. If this happens again, take that big syringe in there.
Yeah.
Well, and just shoot up into his pockets of his, up into here.
Yeah.
And just see if something comes out.
Yeah.
I mean, I think hopefully now he doesn't get stuck as much because he's not going to have those points, but
Right.
that would be one
Okay.
thing to try.
Okay.
So,
Yeah.
alrighty. Anything else you guys need today? Keep me posted. I hope we fixed him today.
I hope so too.
I know, he probably could be unsedated for some of this, but. Alrighty, guys.
Well, thanks
Yep.
so much.
Yeah,
Good luck.
good luck.